All right. Hello, listeners. I'm so excited today. We've been doing this series on the GLP-1 medications. And so far, it sounds like it's been a dream for a lot of people, but that's not the case for everyone. In fact, I've had more than a few people reach out to me and tell me they have had negative experiences on the GLP-1 medications, some to a slight degree and some to a very big degree. And I have a woman joining us today. We're going to call her Jeannie, who would like to remain anonymous. And she has had a very negative experience on the GLP-1 medications. And I don't know the story. So I am very excited to learn right along with the rest of you how this has all gone for her. So, hi, Jeannie, and welcome. And thank you so much for being willing to be on the podcast and share what your experience has been.
Hello, Miss Connie, and thank you for having me. It's very important that people know.
Yeah. So, can you give us a little history? Like, did you have weight loss surgery? Have you struggled with weight your whole life? What's your background?
I have struggled my entire life. I grew up, a heavy child and it followed through my adult years. 2012, I did have gastric bypass surgery. It was very successful.
Nice.
However, I started to gain weight, as a lot of us do.
Yep.
So, of course, in our minds, we've got to hurry and we got to figure out what's next.
Right.
What can I do? What can I do? Well, Connie, in 2018, I had a reversal from a bypass to a duodenal switch.
Really?
I did. I did.
Okay.
Had good success with that. Lost
Hmm.
some weight. Was feeling great. Had 2 or 3 really good years. I started then having a little issue with my sugar,
Uh huh.
little imbalances here and there.
Sure.
So, and talking to my doctor, we discovered that through tests, I was insulin resistant.
Okay.
What they called it.
So, we have
So,
some biology working against
right,
you.
started me on a GLP-1. I was on that for 18 months. I did fantastic with the weight loss. So
Great.
yes, weight loss, but in my case, it just wasn't worth it. I was on it for about 18 months,
Okay.
and the problem started about 6 months into it. And just going to the doctors and trying to figure out what was going on. It took that long.
What were you noticing that was going on? What made you go to the doctor and say something's not right?
The vomiting.
Oh, and
I
how often? How frequently? Was it right after the injection? Did it last all the time?
It was all the time.
Oh,
It
wow.
it I noticed no difference from when I took the injection until it because I had been taking it for so long. It was
Right.
just all the time. Anything I put in my mouth,
Wow.
water even, it was horrible.
Oh my
It was horrible.
gosh.
In about 2 months of that, my weight went from 170 to about 133.
Oh my goodness.
Yes,
How low had you gotten after either of your bariatric surgeries?
140.
Okay. So you were
Yes,
down lower than you had ever been and
yes,
feeling miserable,
yes, I was. I had ended up having a endoscopy and a colonoscopy done,
right?
which we noticed that when I was doing the prep for the colonoscopy, that nothing happened. My body didn't react to the prep whatsoever.
Oh,
So
so you oh gosh.
I
Oh,
start panicking
right. So you were not
and
having the typical diarrhea and getting rid of everything in your system.
nothing,
Oh, golly.
nothing. So he ended up doing the endoscopy anyway, and
Okay.
he discovered I had gastroparesis.
Oh, so nothing's moving.
Nothing was moving, and it was horrible.
And you'd never had that before.
No, no, never.
So getting a little personal here, how were bowel movements before while you were doing all this vomiting after you had been on the GLP-1s?
The bowel movements were okay. I mean, I really
Okay.
didn't notice a big difference.
Okay.
Um, I really didn't even get like the typical diarrhea that some people get.
Okay. All right. So up until the time you had the colonoscopy, or you were scheduled to have the colonoscopy, which it sounds like you did not because the prep didn't work. Is that
Right,
accurate?
right. He tried,
Okay.
and it just wasn't. It wasn't good enough. They couldn't see anything.
Okay. So at that point, your bowels had stopped moving.
Right. They had
Okay.
stopped moving as well. So we found out that I had the gastroparesis. It was in December. And because of the drastic weight loss and the malnutrition, I have had a PIC line in now for 2 years.
Oh my goodness.
Yes, they started me on TPN, 18 hours a day.
Oh my gosh.
And I actually just got off of that maybe a week ago.
Okay, well, let's hear about that. So you have the colonoscopy, nothing's moving. You've never had any problems with gastroparesis before.
Right.
So describe for our listeners who might not know what gastroparesis is, what that is.
That is total paralysis of your stomach. There is just no movement. I would eat on Monday, and what I ate on Monday, vegetable soup is my favorite. And we all know the corn, the carrots, that would be in my system for a week, 2 weeks.
My
They
goodness.
they've done it was gastric emptying test that they performed where I had to eat some nuclear stuff and some food, and it would be present in my stomach for days.
Wow.
Yes,
So it's not just the stomach muscles, it's the intestinal tract
it does.
completely.
It does affect the whole intestinal tract. Upon other testing having done, um, they've since discovered with a colon transit study that I have slow transit constipation.
Okay. And that's
With
is that related to gastroparesis? Something separate from it or
it is related. I've learned since then that the GLP-1s slow down the entire digestive tract, not just
mhm.
the stomach, but the intestines as well.
Okay.
I've been off of them now since December of 2023 and have
Okay.
regained no motility of anything.
Are you serious?
I have got no motility of anything.
Hence being on the TPN.
Right. Um, Now in December, I had to go back in to see a bariatric surgeon, and he had to reverse that back to a bypass, an
Mhm.
irreversible bypass
Mhm.
to get rid of the gastroparesis.
I was gonna say, because if someone has not ever had bariatric surgery, but they develop gastroparesis, a gastric bypass is the treatment of choice,
Right.
correct?
Yes. Yes.
Okay.
And once I had that done, I noticed some improvements, but now I am in the surgery scheduling stage to have a colectomy done. They're going to do a complete colectomy,
So what does that mean? What is it?
removing the entire colon.
Oh my
Yes,
goodness.
and then he will use the ileum and connect to the rectum
Oh my
and
goodness.
use that, anastomosis for that.
Okay, I don't know that word either.
When they connect, they would connect the two,
Okay.
the ileum to the rectum,
Okay.
and that
So
becomes
how will you absorb nutrition?
that's going to be very tricky, I believe. Very tricky. I am following up with my gastrointestinal doctor who keeps track of all of my TPN, my hydration needs. I'm highly anemic and all those things. And he
Sure.
does want to still continue with those things because of it being, much more malabsorption than what I'm used to even now.
Oh my gosh, absolutely. So you went in 6 months after you started on the GLPs, correct?
Started going to the doctor 6 months after taking them. Yes.
Mhm. But
Trying
you
to
stayed
figure it
on
out.
them for another year?
I did
Okay.
because nobody knew,
Right.
what's going on here,
Right.
and of course I'm going to stay on them. I was losing
Yeah.
weight, you know.
So when did they figure out that the GLP-1s may or are related to what you have gone through with this?
It was um, when I had the colonoscopy and the endoscopy in December and when I was diagnosed with gastroparesis, and considering the history and the my health after my gastric surgeries,
Mhm.
they, they ruled it to be because of the GLP-1s, because of the way they work with slowing down your digestive tract.
Okay. So at that point, was that the 6-month mark or was that 18 months
That was
later?
the 18 months. That was the
Okay.
18-month point. It this has not been very easy to even be diagnosed.
I'm
It took me
sure.
right. It took from 6 months. I have been to the Mayo Clinic. I've been to Shands. I have been around, and it's taken a long time. It really
Okay.
has.
So which physician was able to finally make that connection?
Dr. Ilagan,
Okay, what
my
kind of
gas
doctor is
he's
that?
a gastrointestinal doctor.
Okay.
Wonderful man. He made the connection
Mhm.
and referred me immediately to the Bariatric Institute of Orlando,
Okay.
where I have visited before,
Right.
so and they were able to immediately go in. I mean, it was almost like they told me how I felt.
Wow.
Yeah. Yeah. And
Okay.
it took going to 8 different doctors before I found one.
So where were you getting the GLP-1s prescribed from? Was that from a primary care physician or where were you getting those?
My primary care.
Okay. And so as you were having these problems, what was your primary care doctor saying through all of this?
That it could have been something connected to having the reversal from the gastric bypass to the duodenal switch.
Okay, so they were thinking it was related to the bariatric surgeries as opposed to the medication.
She was, yes.
Okay, and so your bariatric surgeon, were they in on the loop? Were these doctors communicating with each other?
My bariatric surgeon, um, he's fantastic.
Yeah,
He took over and he
nice.
automatically knew by looking at all of my test results and everything. He put two and two together as well and said that this is definitely what caused this for you,
Okay,
because
so
everything was fine up until that
yeah,
point. It was just,
and
yeah.
how long had it been between the time you had the revision to the duodenal switch to the time that you started the GLP-1s?
It was 4 years.
Okay, so everything had been going fine, no
Right.
gastroparesis, no issues with going to the bathroom.
Nothing.
Okay,
No
so
vomiting.
6 months into taking the GLP-1s is when the problems
That's when the
started.
problem started. Yes.
Okay. So when during that next 12 months did you get put on the TPN and have the PIC line?
I didn't
Oh
until
my.
right. Everything was just going downhill, and
I
we
bet.
couldn't figure it out. So finally went to my gastrointestinal doctor, and he scheduled for the endoscopy and the colonoscopy, and that's when we figured out. And that was the 18-month mark.
Oh my gosh.
Yes.
And all that time you still continued to vomit?
Every single day. I mean, it has, Connie, honey, this has ruined. I'm not going to say ruined my life because I'm going to beat this, but
Yes,
it
you
has
are.
made it hard, honey.
I can't even begin
Yes.
to imagine, first did were you vomiting those first 6 months also?
Off and on a little bit, but not much.
Okay, and
Not
had
much.
they increased the dose, and did they
They
back
did.
it off at all to try to see what was going on?
We increased it, and then we
Okay,
came down, and then I came off.
okay,
I came off of it at the 18-month mark.
right, and it's been a couple years since you've been off, but
Yes.
but the paresis has remained.
Right. And I last 2 weeks ago, I had my most recent colon transit study.
Mhm.
And what they do with that is you swallow, nuclear little rods. There's like
Right.
120 of
Mhm.
them,
Mhm.
and they see how many go throughout your system. Unfortunately, at the end of the 6 days, I had 100 of them left.
Holy moly.
Yes.
Wow. Okay, no wonder you feel how do you feel on a day-to-day
Yes.
basis?
Bloated.
Yeah,
Yeah,
man.
it's not easy.
Yeah.
Yeah.
Okay, so let's talk about this how this has affected your life on a day-to-day basis. Were you working when you started this, or were you not working outside the home?
I had already retired,
Okay.
but I was keeping my grandkids and
Mm,
watching them. Why? Because my daughter's a nurse, so why she would work, and now I can't do that.
wow.
So I've had two grandbabies since this,
Mm,
and I missed out on all of the things that I did with the other two.
That's right.
It's taken so much.
Absolutely. That's a
You know,
big toll. So what does your day-to-day look like now? And when did you go on that TPN? When did they start you on that to make
they
sure
started
you
me they started me on the TPN in December of 2023,
okay.
and I have a bag, and I
Like,
have it's almost like a your TPN. I have a pump and everything, but I have like it's a diabetic bag actually is what I use, and it's a
what
little
is
backpack,
okay.
and I can fit that all in there,
Mhm.
and I hook it up myself, and I just carry it with me all day long.
Holy moly. So you gotta carry that with you all the time,
I do.
and that is your nutrition.
That's my total nutrition.
Wow. Do you eat anything?
I can eat. It's gotten better since I've had my stomach removed,
Uh-huh.
but up until that point, up until the point where my stomach, I still had my whole stomach, I couldn't
Mhm.
eat anything.
Okay.
I can eat a little bit now, but not nearly enough to sustain.
When did they do I mean, how much of your stomach more than having had a gastric sleeve?
I did have the sleeve when I had the switch from the bypass to the
Right, right. So
yes.
they did that then.
They right. So then he just went on and took out. He said he took out so much that it's not reversible.
Wow. Okay, so you're not able to eat much at all, I'm sure.
No, no, not
Oof.
much at all.
So what's that done to you emotionally? Like, food is something we're used to, and it's social, and it's
Right. It is social, and that going out to restaurants. And it just happened to me. I was on vacation, and I
mhm.
took one bite, and I was away from the table for about 45 minutes.
Oh my goodness. Are you
Yeah.
still throwing up when you eat?
I don't really throw up unless my bowels get so bad. The pain
Mhm.
from the colon is so bad that
Mm.
it will make me vomit.
Do you have to take medicine to try to move things along or
Honey, we have been on Linzess, Motegrity. I think there was even something called Mobic they tried, and I tried those things for years, and things being not being even they're not even covered on insurance, and
oh,
none of
man.
it works. None of it worked.
Oh my goodness.
None of it.
So when you say you have a bag, now I know I'm not medically inclined. I know there are like ostomy bags and
No, no. Yeah, I don't have an ostomy. I have what is I just it's a saline bag for like an IV,
okay.
an IV. So I have one of those with me at all times,
Okay.
and I just put it in my little backpack. So when I'm out in
Right.
public, you can see my IV coming from my arm to the bag.
Okay. So is that IV connected constantly?
Oh yeah, I have a PIC line. I've
Oh,
had it in since December 2023.
dear God.
Yes,
So you run risk of infection and all
yes,
those other things.
yes, yes. It has
Mhm.
been a ride.
Absolutely.
Yes.
So have you been able to share this story very loudly or with very many people? And what do people say to you when you say, "This has been my experience with this medication"?
You know, people don't want to hear it.
Yeah.
People don't want to hear the bad side of it. I have
Mhm.
so many friends who know firsthand, and they still take the medications, which
Mhm.
it's not, maybe it's not for everybody. Maybe, I'm not here to judge,
Right.
but they just don't, people don't want to, they don't want to know. Right
Yeah.
now, it's doing what everybody wants to do. They want everybody, we want to lose weight. We're going to lose weight. And that's my
Yeah.
mentality as well.
Yeah.
Um, so they're just not open to hearing it.
I'm sure because, as you know, and so many other people, especially those listening to this particular podcast, know that when you've struggled with your weight and nothing has worked, and this seems to be such a benefit to so many people, you don't want to hear the
Right.
stories, the horror stories.
Right. And I'm the same.
Have you run across many people who have had miserable experiences with this? Like, is there an online support group?
No, I have not. I have
Okay.
not. I have not run into anyone to the extent of mine. I've
Mhm.
a few people that I have talked to who have regained their motility after they stopped using it.
Really?
Yes.
Wow. That makes you wonder what the heck.
Right.
Mhm.
Yes.
Yeah. So what are the doctors telling you now, like, going forward? What's gonna be your lifestyle?
You know, I've researched, and with speaking to my colorectal surgeon and my bariatric surgeon, I can have a very normal life.
Good.
Um, the bowel, of course, is going to be something to get used to, kind of just like after bariatric surgery, you have to
Sure.
get used to everything all over again. So I'll have to reintroduce foods and do everything. It's going to be strict.
As far as what you can put into your mouth and physically eat?
That and just being careful, being conscious of what I'm doing because it's not reversible,
Right.
so what
Right.
if? So in my mind, what if I get an ulcer, or what if,
Sure.
a palate, or, so those kind of things, of course, keep my anxiety on. But I
I'm
know I just have
sure.
to do what they tell me to do, and they say I can have a healthy, normal life.
That's amazing, isn't
Yeah.
it? My
Even,
goodness.
yes,
Yeah.
even without an ostomy. So,
Right. Wow, that's really truly I'm glad to hear that for you
yeah.
because, wow, you've been through a lot, in a lot of pain, suffered a lot emotionally. So let's talk about that anxiety. And did you experience any kind of depression?
Oh, extremely, extremely. Um, Not being able to leave the house,
Mhm.
you know, because you just don't from one minute to the next. I might be okay now, and I might be doubled over, can't move in 2, 3 minutes from now.
Right.
Um,
Right.
my husband just retired,
Mm.
so we had to stay close because I'm just, you never know,
Yeah, for
you
sure.
know. Um, a little kind of makes you feel a little bit like, why me, or
I can
hope,
imagine.
hopeless a little bit, a little,
Right.
So it definitely has had a big impact mentally.
And especially you went through such a long period of time not knowing what was going on.
Right.
Excuse me.
And the back and forth, being pushed around. I mean, I've had colorectal surgeon tell me that your case is too complicated. I can't do it.
Oh my gosh.
And just this week, like right now, they're in order to have my colon surgery, they have to have a bariatric surgeon on standby.
I'll bet.
So even right now, I'm fighting what feels like to me an endless fight to even get this scheduled where I can have my bariatric surgeon and my colorectal surgeon at the same time.
Golly.
Yeah. It,
Wow.
it it's been hard. And yeah, I definitely have had to be my own advocate
And how have you advocated? That is a really good question.
by staying up front with what's going on with me,
Good.
with the doctors, letting them know, because they're some of them, not all of them, some of them have been quick to tell me how I feel or tell me
Yeah,
what's going on. And I've learned a lot about our medical field as well, being
I'm
pushed
sure.
around, you know. Um,
Mhm.
it's been rough.
I'm sure you know a lot more about how the body works now, and you know a lot more about how insurance works or doesn't work now.
Yes, yes. And I have a nursing background, so it's kind of
Um,
it's good and bad.
yeah, for sure. Maybe you
Yes.
know a little too much.
A little too much sometimes, yes.
Yeah, yeah.
Yes.
So, did it give you relief when you found out, okay, this is what's going on? Did you feel like, okay, now we can do something about this?
Well, it did. Yes. Um, I had no idea that it would be this long.
I'll bet.
Yeah. Um, but the fact that it was diagnosed a lot faster, I have a sister-in-law who has gastroparesis because of diabetes,
Oh my
and
goodness.
it took them 4 or 5 years to diagnose her. So I was very pleased that
Golly.
it was, not a situation like that.
Absolutely.
Yeah.
Has your weight remained so low with all through all of this?
I stay between 150 and 160.
Okay.
I have gotten up to as high as 177. That's 8 weeks with no bowel movement.
Oh my God. Well, I'm glad that you've gotten nourishment to put a little bit of weight back on you because it sounds like you were
Yes,
not very healthy.
I was not. I was very scared.
Yeah.
Yeah,
Yeah, I'm sure.
yeah, it was very, very scary.
Okay, so as you go forward, what kind of messages? Oh, let me ask you something before we go there. You mentioned after the bypass and or after the duodenal switch, sugar became a thing. What did you mean by that? Like you started craving it or like it started affecting you physiologically? What did you mean by that?
Well, between after the bypass, I did great. And it was about 2018 when I had the revision. Up until that point, sugar, my restriction wasn't as much, and sugar is always. I'm one of those people who have suppressed
Mhm.
things
Mm.
psychologically. I
Mm.
have a lot that I need to work through, and
Mhm.
of course, I've always used food as at that,
Sure.
as that. Um, and as I got as I got sicker with the gastroparesis, when with the GLP-1, when I started taking that, at that point, when it started making me throw up, I couldn't eat anything but maybe like crackers, or I could suck on candy.
Mm.
So
Sugar
I made some
sugar
very
candy?
bad, yes, I made some very bad choices.
Mm.
Most definitely.
Mhm.
Most definitely. Trying to I think trying to make myself feel better because of what was going on.
Absolutely.
Yes,
So the coping skill was the coping skill was the coping skill.
exactly.
Mhm.
Exactly.
At any point along the journey, did anybody at your bariatric center or any of the other physicians for that matter say, "Listen," and honestly, I'm thinking it should come from the bariatric place, because they have more knowledge than a gastroenterologist or a primary care physician about people's issues with food and the emotional aspects of that. Did anyone along the way ever say to you, you might want to, in addition to all this physiological stuff you've going on, you might want to look into learning some healthier coping skills in this journey or un unburdening yourself from some of those emotional things that you hold in?
And nobody did. Now my primary care doctor, she didn't mention that, but she knows a lot more about me than most other doctors.
Right,
Um, and it's the coping with things that you just can't let go of.
right.
Those childhood traumas,
Mhm.
those adult traumas even.
Right, absolutely. Did she recommend I'm saying she, I'm assuming that's a she, your primary care.
She is.
Did she recommend therapy at all?
She did not.
Oh, man, see,
Did
that's
not.
where my frustration comes in. It's like you just said she knows you better than any of the other doctors.
Right. And she knows my anxiety, my depression, my mood she knows. So yeah, yeah, she did not.
Did you seek any therapy to deal with the anxiety, the depression, or any of those deeper issues?
I have
Good for
seen a
you.
psychologist.
Good for you.
He's not a very good fit for me, so I'm in search for a new one now.
Mhm. Well,
Um,
that's smart.
yes, yes, because I have to have someone I can talk to.
Yes,
Um,
absolutely.
and there were days I would talk to him and I would feel great going in
Mhm.
and horrible coming out.
Yes, such is the process of therapy sometimes,
Right?
right?
Yeah,
Yeah.
yeah.
But you do need to have someone that you can, really feel comfortable with and safe with when you
Yes.
talk about some of those deeper issues. Um, there's some interesting books. The author that comes to my mind most often in this area is named Gabor Mate,
Mhm.
and he wrote When the Body Says No and The Myth of Normal. And he talks about how so many of our biological issues, our medical issues, can be related to childhood traumas. So
Yes.
Interesting. It might be an interesting read for you.
Yeah, I would like to read that, and I believe that too.
Oh, I
I really do.
I have no doubt.
Our mind is powerful. I believe that.
Yeah, and our minds and our bodies are, pretty much intertwined there.
Yes. Yes.
Yeah, yeah, so I would recommend that. So how has the issue with sugar been since you've been so physically sick?
Um, I can't really eat. It makes me very sick.
Mhm.
Um, so I've not had a problem with sugar whatsoever since then.
Good, good. Wha
Um, and my problem now is regulating my sugar because because I'm not able to eat the sugar and I'm not wanting to, but I'm not
Mm,
able to, and some of the carbs are hard for me. My sugar,
mhm.
of course, bottoms out.
Right. Ugh, go
Yes,
figure, right? Full
yes.
circle on the other direction. So the sugar is no longer like I'm craving it, but if food and or sugar were your coping mechanisms, and from being in the world of bariatrics for so many years that people often transfer to some other maybe unhealthy coping skills if they haven't learned healthy coping skills in this process. So, where do you see yourself on that continuum? Have you learned some healthier coping skills as you've gone along, or have you adopted some unhealthy coping skills in place of the sugar?
Connie, honey, I am still a work in progress
Amen. Aren't
because
we all?
I am a transfer addict.
Okay.
I am.
I
I
appreciate that
am.
honesty.
I am. I am. I am. When I do something, I really go out. Like I craft, and
Mm,
it's all or nothing for me.
mhm.
Or shopping, all or
Yeah.
nothing.
That's a
It's
big one for
it
people.
is. It
Yeah.
is. And I notice those though. I recognize um
Good.
even as far as fitness. There was a time where I was walking 30 and 40 miles a day.
What?
It was all or nothing, Connie.
How many hours are we talking? I mean, it takes
I
me an
would
hour to walk 3.
I would get up in the morning, I would hop on the treadmill, and I would be on the treadmill from morning to night.
Oh my
Connie, honey, it
goodness.
got so bad that I had blisters
Oh my
on the bottom of
gosh.
my feet, but I still got up
Wow.
and walked. And it's so I'm still learning. I'm
Yeah.
still learning.
How did you get away from that, or do you still?
I transferred that to making some kind of craft, I'm sure,
Okay. So while that is probably a
or
healthier
spending more
option,
money.
I
I'm
was gonna say, are you spending so much money on the crafts that it is also problematic?
right, and it could be. However, I am very well aware, so I took it upon myself to financially make my husband in control.
Good for you. I love that because you were
Hold,
reaching out for help saying, "Okay,
yes, hold me
I need some
accountable.
assistance." Yeah,
Yes, hold me
good
accountable
job.
because I don't trust myself.
Good for you. That's what we
Yes,
need to do when
yes,
we
because I
struggle with
know
those.
that when I don't feel the satisfaction from one, I will go from something else.
Absolutely, and it's great that you know yourself well enough. Are you able to catch yourself with whatever it is, with shopping or crafting or
I am.
walking? Maybe it took some time to learn that lesson. Are you able to catch yourself before you go off the rails?
I am now.
Good,
Yes,
good.
I have not always been, of course, but yes, I am now.
And in your therapy, I would really recommend, and this is so common for not just people who've struggled with food, but people like myself who have, I've kind of done the whack-a-mole addiction in my
Yes,
past, and I'm
yes,
constantly a work in progress as well because I can go off the rails with things in a hurry if people are saying, you might want to pull back on that a little, or you might want to look at how much time you're spending. For me, usually at this stage of my life, it's work, but I'm actually pulling back from that because of grandchildren, kind of like
yes.
what you said. But I think, we all, those of us who struggle with knowing where our limits are, need to learn healthy skills. And like you're doing, recognize when I'm getting to the edge of this doesn't seem very healthy right now, and asking for help like you did too. That's
Right.
so amazing.
Yes.
Good for you.
Yes.
Good for you. So now that you're aware of where all these physiological problems came from and the fact that your life has been really, really, really affected in some profound ways, what what do you do with that? Do you just accept that, okay, I went this route with good intention and it didn't work for me, and now this is the result, and go on as best you can?
Well, yes and no. Um, it happened. I have to go on.
Right.
But, you know, anybody, whoever wants to listen, you know,
Mhm.
and anytime I have somebody who will, because I'm in a lot of social settings, anybody who I hear talking about, a GLP-1, I always
Mhm.
try to, give a little bit of insight without being pushy
Good
or
for
or
you.
um, but I mean, I have to go on.
That's right.
I'm definitely going to be careful, do more research,
Good.
and that's
Good.
what I let people know. I can't tell them what to do, but my friends just research it. And
Yes, do
now
the research.
And now there are warning labels. There was not warning labels
Really?
when I started taking the GLP-1. There were no warning labels about the effects on gastrointestinal diseases. And
Mm.
now there are.
Well, that's good. That's a step in the right direction, so
Yes.
people at least have the awareness and can make their
And
choice.
can make the choice, not, and have the knowledge to make that choice and
Right.
not it being made for you.
Do you wish there had been some way of knowing sooner so you could have come off of those medications sooner and maybe not have, I mean, I know wishing and hoping doesn't do a whole heck of a lot at this point, but do you think that as more people have some kind of symptoms, if they get it checked quicker, although you did get it quicker? I mean, you did seek medical assistance quickly, that maybe people who are on a GLP-1 can take this information and say, "Listen, I want you to check. I want to, maybe come off of these and see if anything changes."
Right. Um, you know, I can't say that knowing what I know now,
Mhm.
I would not I would have made a different choice. However, then, and the person I was then,
Sure.
and the desire to lose the weight again,
Yeah.
I would have continued.
Yeah, I get you, and that's why I say I understand why people go on them. It's like, please, there's gotta be something that'll help. So I really do understand that.
Yeah,
And we don't know when we take any kind of medication if we're gonna be that percentage of people who have a side effect. I had a side effect from an antibiotic that,
yeah,
landed me in physical therapy for a while because it attacked my tendons. So, we don't know if we're gonna be
right,
that one. But
exactly.
fortunately for you and for me, we are around to deal with whatever lasting effects there are.
Yes,
So, yeah, I hear you, and I am really sad to hear what the journey you've been on after taking these medications.
yeah. It's been a journey, and even with seeking the medical attention,
Mhm.
you know, I was pushed around
Yeah.
a lot. You know,
W When you say pushed around, it kind of has a negative sound to me, like a negative connotation, like, did people not believe you? Were they like, "Come on, lady, just" you know
they were. This is too complicated. We don't want to get involved.
Oh, wow.
I've had
Yeah.
surgeons tell me this is too complicated.
Yes. In other
I
words.
just I just had I was supposed to have had a consultation Monday with a
Mhm.
surgeon
Mhm.
to be in the OR with my colorectal surgeon. This is a different bariatric surgeon than my own.
Right.
I get a phone call from her nurse today and told me that this particular surgeon said it was too complicated and I should seek another surgeon.
Oh,
Can't
yeah,
seem
and
to
that's
explain
so
it.
frustrating because I get what
Yeah,
they're probably doing is covering their they're like, "I don't wanna get involved with this."
right. I understand that,
But
but and
you
I've
need
gotten
help.
those from, like I said, Mayo Clinic, Shands. I have been all over.
Were they helpful?
No,
Oh,
no.
man,
I
okay.
went to
I was
Shands, and I
w
don't like
and
bashing anyone,
what
but
is Shands, just for people who don't know?
Shands is UF Health. It is a hospital in, Gainesville,
Mm,
and it's part of, University of Florida.
okay.
Yes. Um, and I went there, and it had been going on 9 weeks
Mm,
without a bowel movement,
my gosh.
and I was distended. There was no
Mm,
movement, no noise in my bowel,
mhm,
and they sent me for a CT scan, told me
mhm.
I was constipated, and sent me home.
Oh, dear.
Yes.
Oh my gosh. Have you had some long stay hospitalizations?
I have had a few, um, and it's only been a few because, like I said, my sister-in-law was diagnosed with gastroparesis about 8 years ago.
Yeah,
So once I got that diagnosis, she was definitely a shoulder for me. You know,
I'll
she was
bet.
she was my she taught me a lot how to
Okay.
handle things. So I think she saved me a lot of
Mhm.
hospital stays.
Nice,
But
nice.
I have had 4 just since December.
My goodness. Yeah,
Yeah.
that's really interrupting your life.
Yes. Yes.
Okay, so what I'm hoping is that this message will reach people and say if you're having any kind of symptoms once you start these medications, even if it is several months into it, please seek medical help and let them know. I'm suspicious that this may be a factor.
Yeah, and don't stop. That's it. Don't stop. Be your own advocate. Keep going. If one doctor doesn't listen to
Right.
you, keep going. It's taken me 8. It's taken me 3 colon doctors. So I mean it
That
takes,
is
but
great.
don't stop.
Yeah, that is a great message because they're just gonna throw up their hands and you're the one living with the problem, so
Right.
keep advocating for yourself. Nobody's put you in any research group or anything like that related to these meds?
No.
Have you
No.
reported the medications to the manufacturer so that they
Yes.
can okay, good,
Yes,
good,
they have been reported, and
good.
like I said, now they have warning labels on those.
Good. That's great. That is
Yes.
great. So, anything else you'd like to share about the difficulties you've had? Because, and again, I can't thank you enough for putting this word out there because there may be people suffering that are like, I don't understand what's happening to me. And if they hear this, maybe
Right.
they can get some attention sooner.
Yes. You know, we all, and I'm saying this because I come from the bariatric world, we all want
Mhm.
to be thin.
Yeah,
We have to do it the healthy way.
that's right.
We have to
That's
listen to
right.
our bodies. You know, we
Right.
can't keep listening to our minds, thin, 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 and then our bodies are,
Right.
you know, vomiting or hurting. We have to listen. And it's not all about being thin. You've got to be healthy.
That's right. Boy, I heard something that really applies here, and it was, we think we have a million problems in a day until we have a health problem, and then we have one.
That's right. That's
Yeah,
right.
yeah. So I would also like to add, in addition, and you've already mentioned it, so I'm just restating what you've already added so intelligently that we need to treat all of our bodies. We need to treat the physical, we need to treat the emotional, we need to treat the mental. Deal with all of it
All
so
of it.
that you can be a healthy whole person.
Yes. It's amazing what that one thing that happened in your childhood could still be having a bearing on you.
Listen, woman,
And I'm dealing,
preach. Please
dealing with
preach.
that.
I am a huge advocate, and people will say to me, because I do pre-surgical evaluations and I assess for prior trauma, and people
Mhm.
want to tell me, "Oh, well, that doesn't bother me anymore." Yeah,
Oh,
just
yes.
because you don't think about it every day, it does. And
Oh,
there was
yes.
I'm going to put a link on this episode. There was a wonderful study done by Kaiser Permanente, and it's many, many years ago. But the physicians wrote this amazing article noting that they had no idea how many of their patient population struggled from childhood traumas. And that is actually what led to the ACEs study, which is the Adverse Childhood Events Study. And there's a clear connection, not just to weight issues, but people who have struggled with so many of these adverse childhood events. And you can go online and take the quiz yourself. It's only 10 questions. But people who have had 4 or more of these childhood traumatic events, which we might not think, oh, that's not trauma. Well,
It
it
is.
affects people, and it certainly can be. And so their findings, these medical doctors, this article is great. And I will post the link. It's called Obesity: Problem, Solution, or Both. And the reason they're saying, obviously, it's a problem because it affects your health in so many ways. But for a lot of people, food is a solution. It's a
Yes.
solution to trauma as a kid, anxiety, stress, fear, abandonment. It's something that makes us feel good. And if we don't have support or we don't have people teaching us healthy skills to deal with trauma in our lives, then we have to find something. Children are creative, they're going to find a way to survive. So,
Yes.
food may have been a survival issue
Yes.
for a lot of kids in an emotional sense. So I will link that article. It's really, really wise, great thing for everybody to listen to. And I really encourage people to do that. So thank you so much. And I want to mention that I did post a Facebook question on my main Facebook page
Yeah.
and asked people if they've had negative experiences. And many, many people got on there and shared that they had
Yes.
had negative experiences, but none like the one you're sharing with us.
Yeah.
So again, I thank
Yes.
you for being so vulnerable and being willing to share that with us. But speak up. If you're having trouble with the GLP-1s, do speak up. And again, a lot of people are going to take them because we do, people are, I'm going to use the word desperate.
Yes.
I get it, desperate to lose weight. But if you're having any symptoms, understand that you may get some resolution when you come off of these medications. And you also need to get some mental and emotional support to deal with not only the symptoms and the struggles you may be having because of the medications, but also that absolute, I've got to find something so that you can find some peace. There are certain things we can do to lose weight that are healthy, and we have to come to some point where we accept that this is what our body is going to do. We don't have to be thin or skinny. We need to be at a healthy weight for your body, which I define as whatever weight your body's going to go to, given that you are putting forth the effort that you need to do, and you're able to do the things you want to do and do them with a lot more ease and hopefully with some improved health.
Yes. Most
All right.
definitely.
Well, you've been a gem, you've been a trooper, you're courageous. And if there's anything that I can do to help get this word out besides this podcast, you let me know, okay?
I sure will. Thank you so much, Miss
All
Connie.
right. Thanks everybody for joining in. And be sure to email me with questions or other topics you'd like related to GLPs or others. All right. Thanks, Jeannie. I'll talk to
Thank
you
you.
again. All righty. Bye bye.
Bye.